Hi, I'm Dr. Mike Yates. I see a lot of patients who come in and they're concerned about improving facial appearance. And the beauty of being a plastic surgeon is I can talk to them about both surgical options and non-surgical options to help them look and feel their best. So people may want to be concerned about their eyelids with loose skin of their eyelids, and so we might talk about eyelid surgery. Maybe they're concerned about looseness along the jawline and the neck area. We might talk about neck lift or face and neck lift. Or perhaps they would do very nicely with Botox and filler, which are great ways to non-surgically improve lines and wrinkles and really shape the face. So if we're leaning more towards surgical options, I think the number one thing I see people for is really their eyelids. So if people have loose skin of their upper and lower eyelids and that puffiness and a tired appearance for their lower eyelids, eyelid surgery and a cheek lift work great to kind of freshen up that part of the face. And if you freshen up the eyelid area, you really freshen up the entire facial area. And the second thing I see that really is common would be looseness in the neck area, perhaps some looseness along the jawline with those dreaded jowls. And so that's a common complaint. And I think that if we're talking about surgery and non-surgery, there's really nothing good non-surgically that tightens the skin significantly. We have some things that will make modest improvements in the neck, such as Ultherapy and Fraxel. But if people have a lot of looseness, then I really try to talk to them about an actual surgical correction. So people might request a neck lift. And that's where they're concerned about loose skin and some extra fatty tissue in the neck area. So in the process of educating my patients, I talk to them about the fact that we can receive very nice improvements with neck lift, but we also would want to consider tightening the jawline and the cheeks to some extent. It's almost impossible to just tighten the neck and get a good result without also tightening the jawline and the jowl area. So you really concentrate on the area that gives you the most improvement, but you combine one with the other. So typically the incisions are going to be somewhere in front of the ear, behind the ear, and sort of up in the hair behind the ear. They might go as high as the sideburn area, and there'll be a little incision in the natural crease line underneath the chin. So through those incisions we kind of elevate the skin of the face, and that's a start. But what's most important is to kind of set the foundation. So when we're down there deep and we're looking at the muscles and what we call the fascia, which is the tough tissue of the face, number one, we remove fat to kind of provide sculpting for the jawline and the chin area. But then we tighten the muscles and the fascia. We set a very firm foundation, tightening the muscles here and also bringing the muscles back and tightening the cheek and even up behind the ear. Once that's done, then we tighten the skin and we complete the sculpting of the jawline and the neck area. So we really concentrate on trying to give the patient the maximum improvement for the area of concern. Now, here's a patient of mine, a lady. She came in to see me. She's a delightful lady with a zest for life. She just felt like she was looking a bit older than she wanted to. And she was mostly concerned about her jawline and her neck, really equally. So we talked with her about a face and neck lift. And you can see the really nice improvement we have in the contour of her neck area with those techniques I talked about. Now she happened to also want some more improvement up here, so we did what we call a full facial rejuvenation, and that gave her a nice overall improvement. Now this is a gentleman. We do see lots of guys for plastic surgery these days. He came in being concerned with his neck area. You can see he has a tremendous amount of excess skin and fullness in the neck area. This is a family characteristic. Dad kind of had the same configuration. So you might say, well, just liposuction that fat out. He's a pretty young guy and it should work okay. But in fact, if you do that, what you're going to end up with is some loose skin in the neck area and it would tend to sag down. Wouldn't be a very good result. So again, in the process of educating him, I really steered him toward a neck lift, but really a face and neck lift because we wanted to do some along the jawline as well. Same techniques, same incisions, a very meticulous removal of the fat, both underneath the skin, but also underneath the muscle in the neck area. Tighten the muscles, redrape the skin, and you can see we've been able to achieve a really nice improved masculine appearance for him. So we really want to cater the operation to the patient's concerns, but also kind of educate them on what's necessary to get this best possible result. I'm Dr. Mike Yates. Thanks for joining me today. I look forward to talking to you again. Thanks.